Two. Okay, so when you're removing sutures or staples, you're going to be mindful of the policies and procedures, provide safety, body mechanics, and privacy to the patient. When you look at either the staples or the sutures, you're going to make sure that the wound underneath is well approximated. You're going to assess it for any signs of infection, any oozing, any drainage that you've got going on there. What you can do when you're removing these is you can check for tension when you remove every other one, and you can place steri strips around that. Now, if you're going to place steri strips around that, you have to do 1 inch of skin prep around the wound, and when you cut your steri strips and place them, you only want 1/8 of an inch in between your stitches or staples. So to remove a stitch, what you're going to do is you're going to grab it by the knot, and you're going to wash your hands, put gloves on. You're going to grab it by the knot, and you're going to slide your scissor underneath, and the opposite end you're going to cut, and you're going to pull this away, and you're going to make sure that your count is right. You're going to take out however many they put in. That goes for the stitches and the staples as well. Again, you can take out every other one, check for tension, and put steri strips if you need to. So that's to remove a stitch. To remove a staple is a little bit different, and I don't have a pair of staple removers, so I'm going to kind of pretend with this. Once again, you put on, you wash your hands, put on clean gloves, but what you're going to do is you're going to make sure that all of these staples are lying nice and flat, that there's no signs of infection, that none of them have turned or rotated. So what you're going to do is you're going to take your staple remover, and it should have 2 little teeth on the bottom that you're going to put under the staple, but again, I don't have that. So what you're going to do is you're going to slide it in here, and you're going to keep that staple perpendicular to the skin. And you're going to lift on it just slightly while you're pressing down on that staple, and it's going to remove it. And again, you can use the steri strips, every other one, just to make sure everything stays nice and closed and all those wounds' edges are approximated.